anything on it. And you show that to the patient, you say, now this is what you can do at home. You're going to roll up this towel, and every night you're going to put it under your head, and we're going to try to read that, and they go, yeah. It's how serious do they take it, right? So they come up with this little thing, which is what? It's a little cervical cradle. It's controlled by a little pump on the side to release the air here. But how we utilize this resource in our practice was simple. Patients came into the Whitaker Wellness Institute, and they were always given a choice. Do you want acute care, or do you want rehabilitation care? So no matter what their condition was, they always had a choice of two cares, and they checked it. And it just said, well, God, acute care means we'll do the best we can to pull that arrow out as fast as we can, try to get you out of pain as fast as we can, and help you. And rehab is whatever, we pull the arrow out, and then we try to figure out how to make sure you don't get another arrow stuck in. That's kind of how he explained it. So, give you an example. If a patient comes in, they have a cervical issue, the patient's given a shot on acute care or rehab on the cervical spine. We take the x-ray, show them the straightening of the spine, blah, 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 blah. We go, now look, part of that is you're going to put this in bed with you every night, and you use 4 pumps the first week or whatever. You write a little prescription thing, I'll put it in the file, and tell the patient to lay on it, right? Now you have a system. Now, some doctors, I know Dr. Mata, he charges, I don't know, $100 for these in the office. The way we did it is you paid for a package. You paid $850 for a rehab of your cervical spine, and that included this and 2 sessions with an exercise person and yada, 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 and all the adjustments and therapy. Follow what I'm saying? So you can create the package any way you want. You could add. You got to be real. Make it real. Something like this makes it real. Buy a dozen of these things and watch. But you give them the option. Again, do you choose? Basically, do you want first aid care, just get you out of pain, or do you want this rehab care? 2 different prices for that, right? A or B. You could have an A, B, and C if you wanted. The key is finally get it written out on a paper and let the patient choose. You want to stop doing this talking. Why? Because you don't. I'm telling you, stop talking. Why? It's because you just need to start talking. Right? That's the problem we have. We don't like to sell. That's okay. But then what? We need some patient education that works for us. So if you have services, put signs up. A question. Could a cervical support help you control your chronic neck pain? A sign like that. They go, well, how much are those? They're $80. Okay, I'll take one. I would be even smarter. I'd have it sitting up there with the sign saying, could this help me manage my chronic neck pain? And with the price right on it, right? I don't want any questions. Then they say, hey, I'll take one. Now they've already had it all answered. You follow what I'm saying? We're not talking marketing here. But I'm telling you, this is how you get out of the salesmanship thing, but up your what? Clinical services to the patients.